Hello, my beautiful people. We are here yet again. I'm Dr. Adesoya Adewale. I'm worried. I still get quite a number of people who haven't gotten clarity concerning cervical cancer. We've done videos, I think, twice on cervical cancer and the strategy to prevent cervical cancer. Same strategy used by many developed countries that help them to eradicate cervical cancer completely from the country. Why is it so difficult in our environment? That necessitated the revival of this topic. Cervical cancer, what every lady, every woman should know. Let me quickly describe what cervix look like. When it's a cancer of the cervix, cervical cancer. Cervix is the narrow part of the uterus, the entrance of the uterus that connects with the vagina. This cervix has a part inside of the women and a part outside, exposed to the vagina, exposed to insult from sex, from infection, from all sorts. This is the part that is likely going to be infected with that virus that you've heard about, human papillomavirus. So cervical cancer is a type of cancer that starts with the cervix, and most cases are caused by the persistent infection of that human papillomavirus in the vagina and persistent infection surrounding the cervix. This further leads to a lot of changes in that cervix that eventually leads to cervical cancer. Now, I've talked about human papillomavirus. What is human papillomavirus? It's a common type of virus that is usually contracted via sexual intercourse. Are you supposed to be scared of sex? No. That is why every lady needs to take these measures to prevent cervical cancer. You cannot prevent it by avoiding sex completely throughout your life. Since it's contracted through sexual intercourse and it's a constant for almost every woman who is sexually exposed, how come just some people won't have it cervical cancer? While many people are often exposed to human papillomavirus, a lot of people have a well-built immunity to clear all this virus from the system. That is the natural path for human papillomavirus in that environment. However, in some cases, this HPV, human papillomavirus, refuse to clear, refuse to go for various reasons. Either because of low immunity or because you have a high risk and very stubborn human papillomavirus that refuse to clear. But once it persists, stays there longer than necessary, then it leads to some cellular changes in the cervix that will eventually become the cancer. Cellular changes, I mean changes at the cell level. For those who have done biology and who've heard about cells. When we talk about prevention, when you want to prevent this kind of condition, we can look at it in three ways. The first one is having a knowledge about it. Now, what I'm trying to do, making effort to do, is to educate us about it, which will gear us, which will ginger us to make the next move at the secondary level to prevent this, having an understanding of this problem. Also, making effort to prevent it. How do you prevent HPV? You can decide to prevent it by using condom, like preventing sexually transmitted infection, but that is not foolproof. Studies have shown that it's not foolproof. Then the other thing is to make sure you don't have too many sexual partners, because it's been established that you contract this via sexual intercourse. Imagine having to, in contact with this, you're having variety of traits or types. Multiple sexual partners, you are more prone to having the cervical cancer very fast, very quickly. So, now, what are the other ways you can prevent this? Prior to exposure, if you understand the principles, the concept of immunization, all this, take this vaccine, take this vaccine. Remember, we talk about human papillomavirus infecting the cells and the body immunity clearing it off. In order to be more proactive, getting vaccinated prior to your sexual exposure will help you build immunity strong enough to clear any human papillomavirus trying to infect when the time comes, because the time will always come. That is also a way of preventing cervical cancer. Note, doing that does not necessarily preclude the need to do the proper screening test, which we call pap smear. Pap smear is a quick test where some cells during pelvic examination scrapes off your cervix to examine the cells to check for that sex abnormality, all the changes we're talking about. Guess what? These changes usually take almost 7 years before it becomes cancerous. 7 years. In other words, if you check within these 7 years, while even if the HPV is persistently infecting the cervix, you would have seen the dysplasia, the changes. Then you would have attacked it, address it, treat it, and remove it completely. So, doing that pap smear will help you to see the changes on time and you're able to treat it. So, how often are you supposed to do the pap smear? Who is qualified to do the pap smear? And when do you stop doing the pap smear? Before getting to that, do we do just pap smear and go to sleep? Yes, you can do pap smear. And then you can combine with another test called human papillomavirus testing, HPV testing. Remember the culprit, human papillomavirus. You can actually test for that virus. And you combine it too, and it makes your safety profile top notch. Now let's break it down. Pap smear is what we refer to early detection superpower. You start your pap smear at least 3 years after your sexual debut, meaning that 3 years after your first sexual exposure. Then you do this every 3 years till you are 65. And if you are above 30 and you have the capacity, you can do the combined testing, pap smear and HPV testing, which you will not need to do every 3 years again. You do every 5 years until you're 65 years and above. Now, when you get to 65, do you stop? Yes, if you have done your last 3 tests were all negative, you are free of cervical dysplasia or any human papillomavirus in your test. If you are free to stop testing. Or if any of them is still positive, you still need to take test. Or if you've discovered any dysplasia, any problem, and you got treated, you still need to test until you achieve at that age 3 consecutive negative tests. How difficult, how simple compared to managing cervical cancer when it's full blown is always difficult to manage. So to take absolute control, you just need 3 simple steps. get the HPV vaccine if you're eligible. Even if you're already sexually active, you still need to get the HPV vaccine. Step 1. Now step 2, screen. Never skip your pap smear and or your human papillomavirus testing, because they are your pause button for cervical cancer. They prevent. Be faithful. Avoid multiple sexual partners. Use condom. It helps to prevent this as much as 70%. And then avoid smoking. Studies have shown that smoking can increase or double the risk of cervical cancer in ladies. And also, smoking in the good to go. Please note, precancer has no symptoms, and early screening catches all the invisible threats that are present in the cervix. Cervical cancer is highly preventable. Commit to scheduling that overdue pathway. Vaccinate your kids, your female, your kids, male and female, because boys are the ones spreading virus. So vaccinate your boys too. One test can rewrite your future. Don't take it for granted. Please remember to always stay healthy and save lots of money. Share this, like, comment, and meet us in the next video. Catch you.